Hello, my name is Dallas Veach. I had a brachial plexus decompression to treat thoracic outlet syndrome on my right hand side about 4 months ago. 15 years ago, I was very active in a number of different sports. I had been a swimmer in my youth and then had taken up rock climbing. I had recently got a road bike and was busy climbing hills and descending on my road bike, and at the same time I was doing a lot of work on the computer. I'm a scientific writer by training and had been suffering from very poor ergonomics at the computer. As I read scientific papers in the neurology field for a living, I did some research on the first rib resection and thought that it really didn't have very good outcomes. So I concentrated my efforts in finding conservative treatments for the chronic pain that I was suffering. For the next decade or so, I muddled along, having periodic sessions of physical therapy. I had to give up climbing, was really limited on bike riding and many other activities. And these included also things like crafts and playing the piano and driving. Ultimately ended up overdoing it in a major way, getting excited, surfing my kayak in the waves. And really there was no going back from that. No matter how much I tried, no matter how many other things that had helped in the past I tried, in physical therapy, I just could not get any improvement. I was really feeling quite depressed at that point in time and didn't see much of a future. I made an appointment with Dr. Tollestrup and had a consultation. He did a very, very thorough examination and confirmed that yes, I did indeed have thoracic outlet syndrome and that he thought he could fix the issue with his brachial plexus decompression procedure.
She actually had it bilaterally, which is, more rare or less common. Most people who have the problem just have it on one side. But she was symptomatic on both sides, with the right side maybe being a little worse than the left side. That involves removing the entirety of the anterior and middle scalene muscles and then addressing any other tight tissue bands, or sometimes you can have anomalous slips of muscle. There's a structure called a scalenus minimus that is present in some people that can compress the lower nerve roots of the plexus. That's a fairly complicated procedure to do because of all the important structures right in that area that you're operating on. It's in the base of the neck. So you have the phrenic nerve, which controls the diaphragm. You have big blood vessels. You have all the nerves that go into the arm. You have the dome of the lung there. So there's a lot of things that can go wrong unless you really know what you're doing, you understand the anatomy well.
Immediately on waking up from surgery, I could feel that the neural tension in my body had been relieved. So my right hand that had been regularly curled up like this through neural tension was immediately released and I could open my hand right up. The other thing that was immediately noticeable was that a lot of tension in my thoracic spine that had caused a degree of pain had been released and has not bothered me since. I am in so much less pain. I have resumed a number of activities that I love to do. For example, I've been back in the kayak, I have been rock climbing, I've been scrambling up peaks, I've been on my bike, I've been able to go back to work. My quality of life is just so much better than it used to be. I am very grateful to Dr. Tollestrup for the care he took in the surgery. I think that anyone who's suffering from thoracic outlet syndrome and has been battling this for a long time could benefit from a consultation with Dr. Tollestrup. The surgery really is a vast improvement over the first rib resection. I'm really glad that I didn't opt for a previous surgical option and that I waited, because this has been a really great outcome.